All right, so the final section of this lesson 4 is to deal with gestational diabetes. Gestational diabetes is when pregnant women who have never had diabetes before, but now have high blood sugar levels during pregnancy. Usually this affects about 18% of those that are pregnant, and it can be diagnosed using the oral glucose tolerance test that we spoke about earlier on in lesson number 4. And that's when you have a blood sugar greater than 200 milligrams per deciliter at 2 hours. Usually you're tested for an OGTT during your second trimester, around months 4 or 5 or so. And the reason this is important to be tested for that is because it can have gestational diabetes can be a risk factor for the woman to have develop type 2 diabetes later in life, as well as the child also has a greater risk of developing type 2 diabetes later on in life. So we're going to watch a video here, a short video that gives an overview of gestational diabetes before we talk about how it develops. All right, so here's the video on gestational diabetes.
Hi, I'm Dr. Siobhan Dolan, and I'd like to talk to you about gestational diabetes. Gestational diabetes is a medical condition that causes very high blood sugar levels during pregnancy. If you develop gestational diabetes, it's important to know how to manage it and keep it under control. Gestational diabetes is a kind of diabetes that some pregnant women get. It usually develops after 20 weeks of pregnancy. Even though it usually goes away after you have your baby, having gestational diabetes makes you more likely to develop diabetes later in life. Gestational diabetes can cause problems during pregnancy, like your baby may be born premature, before 37 weeks of pregnancy. Premature babies are more likely than full-term babies to have health problems at birth and later in life. Your baby may be very large and weigh more than 9 pounds. Weighing this much can make labor and birth more complicated, sometimes causing injury to the baby. You may develop a kind of high blood pressure called preeclampsia. You may have trouble during labor and need to have a C-section. Your baby may be stillborn. Your provider gives you a glucose screening test between 24 and 28 weeks of pregnancy to see if you have gestational diabetes. If your provider thinks you're at risk for developing gestational diabetes, he may test your glucose levels earlier in pregnancy. Are you at risk for gestational diabetes? You're more likely to develop gestational diabetes if you're older than 25, you had gestational diabetes in a past pregnancy, you were overweight before pregnancy, or you've gained a lot of weight during pregnancy, members of your family have type 2 diabetes, you had a baby in a previous pregnancy who weighed more than 9 pounds or was stillborn. How is gestational diabetes treated? If your glucose screening test comes back positive, you get another test called a glucose tolerance test to see for sure if you have gestational diabetes. If this test is positive, your treatment may include going more often for prenatal care checkups through the rest of your pregnancy to make sure you and your baby are healthy. Checking your blood sugar on your own. Your provider shows you how to do this and tells you how often to check it. Eating healthy foods and being active every day. Taking medicine called insulin. It comes in shots that your provider shows you how to give yourself. Remember, you get a test for gestational diabetes at 24 to 28 weeks of pregnancy. If you're at risk for gestational diabetes, you may get tested earlier. Gestational diabetes usually goes away after you have your baby. For more information about gestational diabetes, visit marchofdimes.org.
All right, so that was an overview of gestational diabetes, and now we're going to talk a little bit more about it and then the pathway of how it potentially could develop. So when you have a gestational diabetes and it's poorly controlled or untreated, it can really hurt your baby. Again, gestational diabetes, your pancreas works overtime to produce insulin, but the insulin does not lower your blood glucose or the mother's blood glucose levels. Although insulin does not cross the placenta, glucose and other nutrients do go from the mother to the child. There's extra blood glucose that goes to the placenta, giving the baby high blood glucose levels. Well, that in turn causes the baby's pancreas to release excess insulin to reduce the blood sugar. However, since the baby is getting more energy than it needs to grow and develop, the extra energy is usually stored as fat. This can lead to what's called macrosomia, or quote, a fat baby or a larger baby than normal. Babies with macrosomia face health problems of their own, including damage to their shoulders during birth because they're much larger than anticipated. And also because of the extra insulin made by the baby's pancreas, newborns may have very low blood glucose levels at birth and are at a higher risk for breathing problems. So it's very important for the baby to be monitored upon birth. Babies with excess insulin become children who are at risk for obesity and adults who are at risk for type 2 diabetes. So it's really important that people who have had gestational diabetes, that they themselves as well as their child are monitored throughout life to make sure that it reduces to help prevent the development of type 2 diabetes. Well, what happens during pregnancy? What changes? Well, this is a pathway that talks about how a person or a woman who becomes pregnant, how they adapt to the pregnancy to prevent gestational diabetes. So reading the top here, you have this hormone called beta-trophin. And beta-trophin is produced by the liver in response to pregnancy. And the idea behind it is that this beta-trophin that's produced by the liver causes the pancreas to increase the number of beta cells that are produced. And therefore, you have more beta cells that are being functional, more that are available to produce insulin to meet the increased demand of pregnancy for the woman. And therefore, you have more insulin is secreted in the blood that goes to the skeletal muscle and liver to control blood sugar. So this is a theory that what happens to help for individuals who become pregnant. They produce beta-trophin, causes the pancreas to make more beta cells, or at least produce more insulin, and therefore more insulin is available to keep the woman's blood sugar within normal levels. That's hopefully what should happen. However, and this basically is kind of a summary of what we just discussed. So why do some women develop gestational diabetes? Well, looking at this same slide, there are certain individuals who develop gestational diabetes. Beta-trophin is not produced by the liver in response to pregnancy. And therefore, with a reduction in beta-trophin, there is a reduction in the amount or the prevention of more beta cells being made by the pancreas, and therefore less beta cells that are being made and less that are able to secrete insulin into the blood in response to the increased demand due to pregnancy, and therefore less insulin, reduced insulin secreted in the blood by the woman to go to the skeletal muscle and liver to control blood sugar. And therefore, with less insulin, the woman develops gestational diabetes or high blood sugar. The reasons for why this develops in women is unknown, but in some individuals, this is what occurs, leading to gestational diabetes. Again, this is just kind of an overview of what we just talked about in the previous slide. So take a moment, review what is occurring with what causes gestational diabetes, making sure you have a good understanding of this. So this section of gestational diabetes concludes lesson 4. So make sure that you go through all the review videos, again, if you needed, as well as the practice on Blackboard over the type 1 diabetes, and prepare for your exam. Also make sure you do the readings.